Okay, we are going to look into 5 slides for your virtual microscopy. Whenever that you open the slide link, you will have this small box. But what you need to do is actually to click here, and it will open to a larger box. Okay, so for the first slide, for this slide, virtual slide 1, this is actually a lever, right? You can actually zoom down. Okay, use your mouse to scroll up. Okay, and you just probably need to wait for a while until the image come down. Okay, so basically if you have seen a liver cell before, it's not as normal as this. Okay, so what you can see here is all the cells becomes enlarged. Okay, right, the enlargement is called ballooning degeneration. Okay, and this is the effect of cell injury. All right. Okay, the next one, we are going into coagulative necrosis, which is also an example of necrosis or cell death. Again, click this button and to open the image. So basically, this is actually a histology of a kidney. The reason why it is called a kidney because this is the cortex, this is the medulla, and inside the cortex is where you can see all this surrounding. This is basically the glomeruli. Okay, and you can actually see the difference between the top part, okay, and the lower part, right? Wait until the image come a bit. Okay, so basically the top part is actually where the normal kidney tissue is, and the lower part is actually where the abnormal tissue. So you can see this glomeruli has that this blackish dot thing. That is actually the nucleus, right? Okay, wait a bit. Okay, so not only the glomeruli has this blackish dot thing, the tissue, the other component of the kidney is actually the tubules. The tubules also has this um, um, nucleus. Okay, but if you look into the lower part where the infarction occurs, the glomeruli here and here and here does not have any nucleus. Okay, it does not have any of the blackish thing. So does the tubules. The tubules also does not have any of the nucleus. So whenever the tissue or the cell does not have any nucleus, that cell is basically called necrosis, or the cell has gone into cell death. So that area is called necrosis. But in this case, because the kidney has insufficient flow to this particular area, so this is actually what we call as the infarcted area. So you can actually take this lower view image to show the normal tissue and the infarcted tissue. All right. Okay, we wait until the image come down. Okay, so this is the normal tissue and this is the infarcted tissue. But the features of the infarction you can actually see here. Okay, you can go a bit higher magnification. Wait until the image come down. Okay, there you can see these are the normal one which have the nucleus. This is nucleus of the glomeruli. This is the nucleus of the tubules with nucleus. But these are the glomeruli with cells with no nucleus, as well as the tubule that does not have any nucleus. So this is actually necrosis. The third one, the other type of necrosis that you need to know is liquefactive necrosis. So this is actually an example of liquefactive necrosis that can occur in lung. The usual one is actually in the brain, where you can see actually in the gross that you did previously. There's actually a hole there, but in this case, this is actually a case of abscess. Abscess also can give rise to liquefactive necrosis. Basically, you can actually see the normal configuration of lung here. Okay, and you know already that the lung is basically it's supposed to not to have anything inside there. Okay, it's supposed to be empty, all right, but this one it's not really empty because this is actually a lung with pneumonia, which has a lots of neutrophils inside there, meaning there's infection. But here you can still see the alveolar spaces. Compared to here, okay, this is a bit more dense of the inflammation inside the alveoli, but compared to here, you cannot see at all of the alveoli. So when there's actually a destruction of the tissue parenchyma, okay, so this is actually what we call as liquefactive necrosis. So you can actually take image and label this area as liquefactive necrosis. Sorry to again to remind you, you can take this image and show where are the areas of necrosis or loss of nuclei in this area, in these slides. Okay, the next one is KCT necrosis. Okay, basically KCT necrosis is very common in cases of tuberculosis. This is an example of a lymph node. Okay, there's no need for you to know exactly what are the normal features of the lymph node. Just to show you, this is actually a lymph node which has gone into necrosis, and you can actually see because of the inflammation is so long, uh, because of the persistent infection of the tuberculosis, the center of the what we call as granuloma, the thing that you will learn later on in the next few lectures after this, is having no nucleus in the middle. Okay, we wait until the image come down. Okay, like this, right? Okay, so basically there's actually inflammation there. Alright, there's fibrosis, but basically here there's no nucleus at all. So this is also necrosis, and again does not have any structure at all. So this is what we call as caseating necrosis. Okay, so this is what we call as caseating necrosis. And the last one is on thrombosis. So you can actually open this, and this is actually an area of lung. Again, this is actually alveolar spaces, but in the lung there's definitely blood vessel. This is a normal blood vessel, but there's another half of a blood vessel here which has this red thing here, right? And this red thing has the feature that has lines. Okay, this yellowish thing is RBC. Okay, basically RBC, but the pinkish thing outside here is what we call as fibrin. But in here you can see there's an alternating layer of the RBC and the fibrin. Okay, and this alternating layer of RBC and fibrin, okay, you can take this image, label the RBC and fibrin layer, and this is what we call as lines of Sons, a very typical feature of thrombosis. Okay, that's all. Thank you.